We believe that cultural competence occurs along a continuum, from the level of cultural destructiveness to the level of cultural proficiency. Oftentimes, when we're designing training in particular, people may approach it from a capacity of cultural blindness and that we treat things all the same. It's very important to be able to tease out those individual differences, those cultural factors that will enable us to design training in a way in which it is indeed most effective. Cultural competence, again, looks at this continuum, and it really doesn't matter where you start along the continuum as long as you're progressing toward the positive end of that continuum. I'd like to offer a definition of linguistic competence, which is very, very key, given the demographics that we talked about earlier in this presentation. With significant numbers of people in this country speaking a language other than English at home is something we certainly must attend to. We're defining linguistic competence as the capacity of an organization and its personnel to communicate effectively and convey information in a manner that is easily understood by diverse audiences. This may include individuals who have limited English proficiency. It may also include individuals who may or may not be literate in their language of origin or in English, and also individuals with disabilities, all of whom may indeed have unique communication needs as we're designing training materials and conducting training. Also, organizations must have in place policies, structures, practices, procedures, and dedicated resources to support this capacity. As we think about examples of linguistic competence, it may indeed be bilingual and bicultural staff and or multicultural and multilingual staff. It may indeed be the ability to provide foreign language interpretation services, also the ability to provide translation services. Other things we think about may be ethnic media in languages other than English, also looking at materials that are in easy to read and low literacy formats that may include pictures and or symbols. We also need to look at materials in alternative formats, including Braille and large print and audio tape, again, accommodating the needs of individuals who may have disabilities. Another thing that's very important as we think about linguistic competence is, again, ensuring that you may have informed consent. And this may be informed consent in terms of participation in training and or a medical procedure and or with some videotaping or other approaches. It's very important to ensure that statements are written in a way in which people can indeed understand them easily. And in many instances, many of our forms are so complex that people have a very, very, very difficult time providing for informed consent. So as we think about cultural competence, linguistic competence, community engagement, and consumer, community, and professional partnerships, we think that all of these fit together very nicely, just as is symbolized within this puzzle, that we need all of these things together in order to address the diverse needs of populations in the United States. And again, in promoting health promotion messages that indeed will be effective within different populations. We're now going to focus somewhat on cultural and linguistic competence within the context of organizational change. Oftentimes, in many situations and in many organizations, people approach cultural competence and linguistic competence from a perspective that they can simply provide training. And while this is a very effective way of approaching it, it is not the only way in which we need to indeed approach cultural and linguistic competence. As we think about cultural and linguistic competence within the context of organizational change, the leadership literature offers us a couple of perspectives that were very, very interesting and very applicable within organizations and agencies and their personnel. There is the concept of adaptive challenge and technical challenge. Typically in the work that we've done nationally, we've seen people approach cultural and linguistic competence as a technical challenge, looking at a fairly simple solution to something that's very complex. We believe that achieving cultural and linguistic competence is indeed not just a technical challenge, but also an adaptive challenge. And a way in which we're able to differentiate between the two is by simply asking the question, does making progress require making changes in people's values, attitudes, and/or habits of behaviors? And I'd say that the answer to those questions as it relates to cultural and linguistic competence indeed would be yes, 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 yes. So that tells us that we need to approach this in a way that would include something more than a simple solution and more than just offering training. There has to be numerous other approaches in terms of policy change, looking at attitudinal barriers, and helping people to approach their work in a very different way. So as we think about cultural and linguistic competence within training, for training activities and health promotion, these are some things that we can think about in terms of that. I'm going to pose a series of questions. So what are the implications for cultural and linguistic competence within professional development and in-service training for health education personnel? What might you do differently? What are the implications in the provision of interpretation and translation services? How that might be approached differently? What are implications for procurement and contracting? Again, very key. Lastly, looking at telecommunication systems, looking at time and level of effort for health promotion. What are the implications for cultural and linguistic competence in creating training content, approaches, and materials for diverse audiences? What indeed are the implications for cultural and linguistic competence and community engagement? Consumer education, consumer partnerships and collaboration, and also looking at how we begin to translate research for families and communities. All of these are very significant considerations as you're thinking about designing training for health promotion and for risk reduction. I'd like to end on this slide in particular. I think it's one that's very poetic and very simple. And it looks at, as a culturally competent fill in the blank, I'm capable of positively interacting with people who do not look like, talk like, think like, believe like, act like, live like me. And as we think about this, and this was developed by the Multnomah County Department of Health, how do we begin to think of this and apply it in the work that we're doing in designing training materials and conducting training for health promotion?